topic for a similar towards the disinfecting, that is nothing but a disinfectant. So what will be the consequences of the over usage of disinfectants? What impact it will create, whether it is same or vary from one environment to the other environment. In these aspects, students they have their own case studies. There are total certain number of case studies. So they are going to speak their own perspective manner, especially from one area to another area. It is not a similar. Each one case study is a different aspects. So you may get the different aspects of the disinfectant over usage. So the students will continue and they will give their own opinion. Karpan.
Hi, I am Shubha. Here I am going to explain the excessive usage of disinfectant which leads to antimicrobial resistance during COVID-19. So let me know first what is disinfectant. A disinfectant is a chemical substances that kill or inhibit the growth of a microorganism, example phenol alcohol. During COVID-19, disinfectants and sanitizer were used everywhere while they helped to control the virus. Overuse created a new silent problem which is a resistant microbe. What happens during the COVID-19? When COVID-19 started, people were afraid of infection and they leads to overusage of the disinfectants. In hospital, they also use the excessive use of a strong biocides to control infection. So let me know what is antimicrobial resistance. Antimicrobial resistance means microorganisms like bacteria become resistant to the drug that once killed them. Because of this, antibiotics stopped working properly. How disinfectant overuse leads to antimicrobial resistance? While disinfectants are used too often in low or incorrect concentration, some bacteria do not die completely. This surviving bacteria adapt and become stronger. So, case study, evidences from COVID period. Studies after the COVID revealed that the environment samples like wastewater and soil had more resistant bacteria. The amount of antibiotic resistant genes increased in many places. Why it is dangerous? In future, common infections may not respond to antibiotics. Simple surgeries and treatment can become risky. Hospital infection can become harder to control. What should we do? Use disinfectant only when it is necessary, not everywhere and all at the time. So to conclude, disinfectant saved life during COVID-19, but their overuse created a new risk, which is the antimicrobial resistance. We must remember that more is not always better. Rational, scientific and responsible use of disinfectant is the key to protect the present and future health. Thank you.
I am Pragati. I am going to explain about humidifier disinfectant case happened in the South Korea. The humidifier disinfectant disaster occurred in South Korea between 1994 and 2011. Many companies sold disinfectant liquids that were added to humidifier to prevent bacterial growth. When the humidifier was used, the chemical mixed with water was sprayed into the air and inhaled by people. The main harmful chemicals were polyhexamethylene guanidine and methylene lysothiazolinone. These chemicals damaged the lungs when inhaled. Many people, especially pregnant women and young children, developed serious lung disease such as pulmonary fibrosis and acute respiratory failure. In 2011, doctors noticed unusual lung injuries in children and investigated the case. Studies confirmed that humidifier disinfectants were responsible. The government banned this product the same year. More than 1,800 deaths were officially confirmed and thousands suffered lung damage. It became one of the biggest environmental health disasters in South Korea. In conclusion, this case highlights the importance of proper safety testing of chemicals, strict government regulation, and public awareness about product safety. Thank you.
Hi, I am Tendran. I am going to explain occupational health worker risk. Occupational health workers are at high risk of skin and respiratory problems due to frequent exposure to disinfection and cleaning chemicals in healthcare. Why disinfectant causes problems? Many commonly used disinfection contains chemicals such as alcohol, ethanol, chlorine compounds, hydrogen peroxide. Repeated exposure can irritate the skin, eyes, and respiratory tracts. Skin risks: redness, dryness, itching, burning sensation. This happens when chemicals damage the skin's barrier, affect repeated exposure. Allergic contact, dermatitis, rash, swelling. Serve itching, occurs when your workers become sensitive to chemicals. Respiratory risk: cough, wheezing, chest tightness, shortness of breathing, occupational asthma. Thank you.
Hi, I am Sajida. I would like to share a few information about overuse of disinfectants during COVID-19. During COVID-19 pandemic, people become very conscious about hygiene and infection control. Disinfectants were widely used in homes, hospitals, public places, and even on roads. However, excessive and improper use of disinfectant can lead to broader health and environmental problems. First, many people frequently used alcohol-based sanitizers. Chemical like sodium hypochlorite caused skin irritation, eye damage, breathing problems. There were increased cases of accidental poisoning, especially in children. Second, spraying disinfectants. The spraying disinfectants mainly used on the streets and open areas. It may affect soil microorganisms and aquatic life. These chemicals entered water bodies and disturbed the ecological balance. Overuse can also possible antimicrobial resistance. This pandemic showed the importance of hygiene, but it also caused many negative effects in our lives. Thank you.
Hi, I'm Tanuja. My case study is about overuse of disinfectants in senior homes, which refers to the elderly people or aged people. The case focuses on senior care or nursing homes. Disinfectants are used very frequently to prevent infections. The common agents of disinfectants are bleach, alcohol, phenol, quaternary ammonium compounds, glutaraldehyde, formaldehyde, etc. Elderly residents are a vulnerable population due to weak immunity, fragile skin, and chronic lung disease. The overuse of disinfectants leads to skin problems like dermatitis, lung and respiratory problems, chronic lung infection, etc. The skin problems are redness, itching, dryness, peeling, and rashes, causes irritant contact dermatitis, lung and respiratory problems. It causes cough, wheezing, breathlessness, and chest irritation. Also leads to asthma, COPD, and chronic bronchitis. The antimicrobial resistance. Surviving microbes adapt and become resistant. These resistant microbes may also show antibiotic resistance, results in hard to treat infections in elderly resistance. The conclusion: the disinfectants should be used only when necessary. It should be followed safety protocols and etc.
Hi, I'm Samrita. My case study about poisoning from self-administration of disinfectant in COVID-19. First, the major of this, after the usage of different disinfectant, the smell of this all causes the respiratory damage. Example, bleaching powder plus ammonia plus toilet cleaner produces the toxic gas release. It causes the respiratory damage. For example, first of all, we all know the ad Harpic. They say Neelam toilet ku, Siyappu bathroom ku. So these of release the toxic gases, causes the respiratory damage. Few even try to drink or inhale the disinfectant. So how to prevent this? Low usage, read the direction of this, follow the contact time, don't mix the chemicals. Thank you.
Solution. I am here to speak about the overuse of disinfectants from a pharmacy point of view. Disinfectants are essential for identification and control, especially for the COVID-19 pandemic declared by the World Health Organization. However, excessive uses can cause problems. Overuse may lead to antimicrobial resistance, skin and respiratory irritations, chemical toxicity, and environmental damage, and improved dilution and mixing of disinfectants can also produce harmful gases. As a pharmacist, we must educate patients about proper usage, correct dilution and safe storage. Rational use is more important than excessive use. And finally, in pandemic situation, there are many people they consume a sanitizer as a holy water in spiritual places. This shows how the peoples are uneducated and have a low level of idea about the disinfectant. This may cause many deaths. It is more worldwide recorded. Thank you.
We are going to sum up these case studies. I hope that our students give excellent case studies from their own perspectives. So this may give a little stimulation, little information towards the disinfectant, how to use, what are the do's and don'ts. Thank you all.